Hello, dental professionals out there. It's Dr. Leath. I wanted to come to you today and talk to you about no numb fillings. Not every occlusal filling needs to be numbed up. I did it today. I think I had 13 occlusal, 14 occlusal lingual, and 15 occlusal lingual, right? After doing this for some period of time, decade and a half, you get to know a thing or two. You can do this in your sleep, but if a time comes where you need to do these occlusal fillings, these were black, by the way. I mean, they were like, they might need numbing, they might not. So I started with the fissurotomy burr. Maybe it's about 3 millimeters in height, looks like a diamond, and it's a carbide. Very, very, very fine carbide. It's basically got a finishing burr. You have to look real closely, otherwise it does look like a diamond burr. But it's like a fine flame fissurotomy burr, about 3 millimeters in height, maybe about a millimeter and a half in width. And you just run it in the groove and go slow. Put the water on and tell the patient, if you start to feel something or you think you're about to start to feel something, just raise your left hand and I'll stop. I'll get you numbed up. But 90% of the time, we don't have to numb patients up for this. Okay, so those 3 fillings, it took me, less than 10 minutes from start to finish, doing it the right way and making sure that the caries all been removed. And I asked the patient, did you feel anything? No, not at all. And sometimes it surprises you. But just a little pearl to tell you, not all fillings need to be numbed up that are occlusals or occlusal linguals, especially if you catch them early, which is the importance of people coming every 6 months. Now, I don't recommend that for any class 2s, any mesials or distals, but certainly the occlusals and the occlusal linguals you can get away with. And what I mean by get away with is you don't have to numb them up, okay? That's what I mean by getting away with. Why numb up a patient if they don't have to? So anyways, hopefully that provided some value to you. Hopefully you can use that in your bag of tricks. You can always start, and then if they raise their left hand, you can always give it to them. And then at that point, if they're still feeling something, you can say, hey, look, I think I only got 2 or 3 more seconds left. If you want me to numb you up, I'd be more than happy to, but just know that I think you're almost done. And then again, I think you're going to have that 90% say, no, just keep going. And you're still going to provide them a great experience, okay? It's nothing to do with making the patients feel something. It's about, getting them through treatment with the intended result with the least amount of discomfort as possible. And a needle for some is pretty discomforting. So avoid it when you don't have to use it.